Hey guys, good afternoon or good evening. So for my presentation today, I'll be discussing 4 main things. Number 1, what is drug classification and 6 categories that I selected. Number 2, the drawbacks of drugs. Number 3, the risks that can come with drugs after consumption, both long-term and short-term. And number 4, what is toxicity? But before I begin, I'm pretty sure from a young early age, most of us grew up hearing that drugs were bad for us and that they could cause us so much harm. But in reality, that's not the case. You see, it's not the drugs that are the problem, it's the users and how much they abuse the drugs that they're taking into their bodies. And I'm not here today to stop anyone or force anyone to stop any sort of use of a drug. I'm just simply advocating for drug awareness and so that you can make a commitment to yourself today on where you are now with your understanding of drugs. So, let's begin. My reasoning for choosing this topic. Again, it's pretty simple. My purpose for persuading you guys today is to make you more aware of what drug classification is, the drawbacks of drugs, the risks that can come after consumption, and what is toxicity, because I feel like that's really important, and I feel like that can, help us in the long run if we are more aware of, toxicity and different toxicities. What is drug classification? Drug classification is the process of grouping and organizing drugs into certain categories. The following categories that I'll be talking about today would be stimulants, antidepressants, depressants, opioids, hallucinogens, and psychotherapeutics. First one on our list, stimulants. And stimulants are drugs that make you feel energized or awake. Drugs that would fit in this category would be caffeine, crystal meth, cocaine, and weed. I'm pretty sure that there's more, but I just decided to list these 4 instead. Depressants. Depressants are drugs that lower inhibitions and impairs judgment. Inhibit it to stop. It basically lowers what you likely won't do or are cautious of when you are sober. So, for example, I'm sober, I'm cautious of my surroundings, I drive safely. But when I'm drinking alcohol, that all changes. And even though I'm under the influence, I'm convinced that I'm able to go behind the wheel. And that could be a problem because I can possibly die or cause an injury to myself, or I could be the reason why somebody else is dead or has an injury. So that's basically what happens when you're under the influence of depressants, You basically think that you could do things that, you would be more cautious of doing when you're sober. The drugs that would fit in this section would be, again, alcohol, central nervous system depressants, or sleeping pills. And got some images for you there. Antidepressants. Antidepressants are drugs that treat depression. So they're medication that your doctor will prescribe you over the counter. Drugs that fit in this section are, I can't really pronounce those, I'm so sorry, but here's some pictures. And basically these are drugs that, help with mental illness, so like anxiety, depression, which is what I just mentioned, and things like that. Opioids. Opioids relieve pain, give you a high. Drugs that would fit in this category are heroin, morphine, and prescription painkillers. And here's some pictures. Also, I apologize if you guys hear some scraping and stuff. That's my cat trying to come in and she can't, so let's just ignore her. Hallucinogens. Hallucinogens are basically in the name. They're drugs that make you hallucinate, and drugs that fit in this category are LSD and magic mushrooms. And here are some pictures to show you what that feels like. Psychotherapeutics. These type of drugs in this category will calm your psyche / your mental. They're drugs that treat mental illness. So antidepressants again, anti-anxiety drugs, and antipsychotic. Psychotics. And yeah. Now, drawbacks of consuming drugs. Drawbacks, basically what drawbacks means is the downfall, downside. So, withdrawal. is the first one. It's what happens when you stop using a drug, the opposite of the effect of the drug. So, for example, let's say I am a heavy coffee drinker. You know, I'm addicted to coffee. I love my caffeine. I always have a cup of coffee in the morning, at the night, whatever. Once I stop drinking coffee, let's say for a day, maybe 2 days, I instantly get a headache, you know, and that would be withdrawal. That's literally the definition of withdrawal. Like, you know, I might feel slow, unenergetic, and that's what happens after, you know, like not having my caffeine. And that's basically what happens too with drugs, you know, like other drugs. Like if I stop, this is basically what would happen, like symptoms that would happen after I stop. Mental/physical dependence, triggers set off use. Addiction, so change in behavior/irritational behavior due to brain changes. Brain could be rewired for survival based on a drug. Drug use will increase dopamine activity. So, you know, when you're addicted to a drug, your mind kind of goes on survival mode, so you'll do anything for that drug. So you'll rob possibly somebody for their cash. You'll probably tell your dealer to let you, you know, have your little drugs until you could get your money up. You know, your mind is just on survival mode. You'll do anything for that drug. So that's basically what can happen as well. Now, toxicity and risk. This is what I really wanted to get into. So, what is toxicity? Toxicity is the level of which substance or mixed substances can cause poisonous or harmful effects. There's chronic toxicity, acute toxicity, behavioral toxicity, and physical toxicity. Now we're going to talk about acute versus chronic. So acute is basically at the time the drug is in your system. So like what happens, for example, if I take LSD right now, you know what I mean? That's what basically acute is. Chronic is more long-term effect. So like what happens to me after taking LSD for like 6 months or 3 years, you know? So acute is basically like while the drug is in your system, like right there and then. But chronic is more of a long-term thing, you know? So what can happen to me in 15 years from now, 3 years from now, 6 months from now? That's basically the difference between the two. Then you got physical versus behavioral. So physical, that's my body. So organ failure, overdose, death. Also, I'm so sorry if you guys can barely see this. I'm just gonna, y'all could probably screenshot that. Behavioral, depending on how much you take, it's a risk and can change your behavior. So again, back to the alcohol scenario. When I'm not on alcohol, I'm more cautious of my surroundings and I know what to do safely. But when I'm under the influence of alcohol, you know, I'm less cautious of my surroundings. And even though I know I'm not supposed to be driving, I'll feel like I'm capable of driving because I'm under the influence. So, you know, I'm not really paying attention. So yeah, and I'll get behind the wheel and try to drive home, and that's not a good idea, obviously, because we know what happens. Future and health risk. So now we're gonna get into the risk. So you can get a stroke, you can get cancer, you can get lung or heart disease, dependence and addiction. So like I said, again, your mind kind of goes on survival mode and you become dependent on a drug, which is not good because that could be really hard to, you know, stop. Injury and accidents, we know that happens a lot with drug use, substance use, all of that. Family history of substance abuse. So, you know, having an addiction sometimes results into family history. Like, how can I say this? Sorry if I'm not wording this right, but basically, if your family has a history of drug and substance use, you're most likely to get that too. You know what I mean? Like, if your family is known for alcoholism and stuff like that, if you don't change your way, like, well, I don't want to say like that, because, you know, like, basically, if you don't break the cycle, you could become the cycle. And so, yeah, that's basically what family history of substance abuse means. Like, you know, like, if your family is already known for that, possibly you can get that too. You know, you can become addicted to alcohol or any sort of drug use too, if it's already in your family history, you know. Now, these are the sources that I use. I added the links. So the first source is a video that discusses more about drug classification, if you're interested into that. Again, I didn't list all the categories, so I recommend you watch that video just so you could get more in depth with drug classification. Number 2, an article that's very informative. I recommend you guys read that too. And number 3, a documentary that I recommend. It's only about opioids, but I still think you should watch it. If you're sensitive to drug use and stuff like that, I understand, but I personally like this documentary a lot, because even though it's just about opioids, like, it gives you a brief, like, you know, background on opioids and people that actually had addictions to opioids, and some victims that had passed away because of opioid addiction, and it's just really good. So I recommend. And that's it. I hope you guys enjoy my little presentation. Unfortunately, my laptop was giving me some difficulties with Zoom, so that's why I have to do it like this. I know it's a little ghetto, but again, I hope you guys like my presentation, and yes, have a good day. Thank you. Have a good rest of your day, but thank you.